psychosocial rehabilitation on the world. The project Dance and Go On was created with the intention of bringing out of the center of the Department of Mental Health of Torre del Greco the dance group Dance That You Go, active since 2009. Dancing bachata becomes a rehabilitation tool to express emotion through the body and to open to the outside, on the territory, overcoming the fear of being judged by the others, the prejudice and the social stigma about mental illness. The bachata was chosen and used for its structural characteristic and for the simplicity of the steps. It is a dance that promotes immediately the encounter with the other and it activates non-verbal communication. Dancing with the other, the patient not only recovers the relational dimension, but also he discovers the contact with his body. They also improve the ability to sense and communicate emotion. The project Dance and Go On has the following objectives. First, to turn on the territory the rehabilitative experience of the dance group, to promote the integration of a patient in social context with performances of bachata, having a prompt and effective action to psychological well-being with improvement of mood. 4. Increasing the skill and artistic expression. 5. Increasing self-esteem. 6. Stimulating the care of oneself and one's body. 7. Causing the overcoming of inhibition and social phobias. 8. Fight against stigma. The group is composed by 15 patients with diagnosis of 1 patient, delusional disorder, paranoid schizophrenia disorder 2, neurotic depression 3 patients, major depression disorder 2 patients, schizophrenia mood disorder 2 patients, bipolar disorder 1 patient, schizophrenia mild mental retardation 2 patients, autism disorder 1 patient, obsessive compulsive personality disorder 1 patient. We have a weekly meeting to do the same on Tuesday afternoon from 5 p.m. to 6 p.m. to prepare and train the dance group for performance outside. Nearest the event, there is a second week meeting to prepare the choreography. We have external exhibition to the center and monthly interviews with patients and administration of VADO every 6 months. What are our operating modes? To improve the artistic performance of dance group, to prepare the group to perform on the territory, to contact local agencies and schools, sports and cultural clubs, public and private agencies, territorial descent. Then we have to promote networking with public and private agencies for the organization of events, to disseminate and publicize the rehabilitation activity of the dance group, to do the diagnostic evaluation of science difficulties, strengths, motivation of the patient, and to monitor the project with the administration of the VADO. That is a test of psychosocial rehabilitation. The word VADO stands for Evaluation, Activity, Definition, and Objectives. The test consists of several evaluation tabs used for the definition of the objectives of rehabilitation. What are the results? In 2009, the group took part in a sporting event on the city of Torre del Greco in Naples, performing on a stage in the center of the city. It presents a brief choreography of bachata. Patients were very happy because they felt appreciated and accepted in spite of their mental health problems. So they have overcome the fear of the judgment of the other, connected to the social stigma against the psychiatric illness. They have strengthened the self-confidence and self-esteem. In 2015, the group took part in a sale of Caribbean dances to the Cuban Academy at the Theatre Room in Fortici, Naples. Through a video, it presents the work done by the group over the years, both in the research of the Department of Mental Health and in external context. Patients received compliments and congratulations. They felt appreciated for their work. This experience has increased more their self-confidence, self-esteem, and increased the desire to participate in other events. Patients have been enrolled in the social network Facebook to communicate with each other even outside of the center. They created a group to share photos and videos of all performances done. The results achieved from 2009 to 2015 with the rehabilitative activities of the Caribbean dance have been verified and confirmed by the administration of the test value, by the clinical evaluation of patients in medical records, and by positive recognition and appreciation of family members with a self-administered questionnaire. This is the evaluation of results with test value. There is an increased score of the scale of personal function, FPS, emerged mainly due to an improvement in the area of personal and social relationships, compared with the beginning of the project. The majority of patients presented an increasing result, starting from a level of nervous dysfunction and going to an evident one. This is depicted by following chart. We have 15 patients, 8 males and 7 females. What are our future goals? To facilitate the enrollment of all patients to Cuban Academy and the participation in lessons with the teacher and attendance school, to improve artistic performance and social integration. Then, to organize performances on the territory, integrating dancers of our group with those of the Cuban Academy, to promote integration and to overcome the stigma toward mental illness. And finally, improving and enhance the image of himself as body. Conclusion. Dance and Gone has been useful for patients to emerge from social isolation, to overcome the fear of the judgment of the stranger, and especially to integrate themselves on the territory. Seeing the joy on the faces of patients to perform in public is an incentive to continue our rehabilitation program. Thanks for your attention.